How's it going, guys? So we have a pass level cardio question for USMLE. You need to know your murmurs for step one. It's fair game. For step two, they are going to incorporate these buzzy descriptors into broader vignettes and then expect you to be able to extrapolate out other more difficult information. So before we get started, please subscribe to my channel. I really appreciate it. Give the video a like, really appreciate it. Find me on Instagram, Mehlman_medical, MEHL_medical. Link is down below. Find me on Telegram. Recently created a Telegram group and channel. Links are down below. Now let's start the fucking question. 65-year-old woman, 2-month history, fatigue, shortness of breath, no significant past medical history. She has a blood pressure of 160 on 50. So we have a significant disparity between the systolic and the diastolic blood pressure. This is referred to as a wide pulse pressure. This is head bobbing. This is bounding pulses. This is classic aortic regurgitation, okay? Blood is ejected from the left ventricle into the aorta, and then we have the regurgitant/incompetent aortic valve. Blood quickly collapses out of the aorta back into left ventricle, so our diastolic blood pressure falls precipitously. Brisk upstroke with precipitous downstroke. That is aortic regurg, okay? Head bobbing, bounding pulses, wide pulse pressure. Very important. Aortic regurg can be seen in connective tissue disorders, Marfan syndrome, Ehlers-Danlos, in addition to mitral valve prolapse. But one of the most important causes of aortic regurg in USMLE is going to be aortic dissection. Okay, so you can get a retrograde propagation of the dissection toward the aortic root, cause dilatation and ensuing aortic regurg. Okay, very important. Bounding pulses. All right, so we're just going to go backwards here through the answers, and I will just quickly mention this numbering system. 1 on 6 is cardiologist only. It's a very faint murmur, almost inaudible. 2 on 6, faint murmur heard with the stethoscope. 3 on 6, loud murmur with the stethoscope. 4 and 6 is not only a loud murmur, but also parasternal heave or thrill. Heave is a systolic impulse of the chest wall moving outward that can be palpated. A thrill is a palpable murmur. 5 on 6 is a murmur so loud you can hear it with just the rim of the stethoscope. 6 on 6, you don't even need to use the stethoscope to hear the murmur. So let's just go backwards, as I said. 6 on 6 murmur, wrong fucking answer. This is prosthetic valves, okay? Patient has a metal valve. You can hear the clicking while you're sitting in the chair next to the patient, speaking with him or her during the physical exam. 4 on 6, to and fro murmur, wrong answer. This refers to patent ductus arteriosus, PDA. So this will show up 3 ways in USMLE. Our very buzzy, continuous machinery-like murmur can be pansystolic, pandiastolic, which just means it's continuous if it's there through systole and diastole, and also to and fro, okay? To and fro, there's a question on offline NBME 6 for 2CK where the question rides on you knowing to and fro means PDA in order to get it right. Every fucking student says, what the fuck, when they see to and fro on that exam. That's how I know that USMLE wants you to know it's to and fro. I mean, PDA, all right? Next one, 3 on 6, rumbling diastolic murmur, wrong answer. This is mitral stenosis. So classically opening snap, followed by a mid to late decrescendo rumbling diastolic murmur. History of rheumatic heart disease as a kid. I've seen one question 2CK forms where they say there is no opening snap, but they're overt about there being rheumatic heart disease as a kid, and there's a 4 on 6 rumbling diastolic murmur, okay? You can also rarely get a right-sided S4 heart sound if it backs up all the way through the lungs to the right heart and causes a stiff right ventricle. And mitral stenosis can present during pregnancy, okay, due to the increased plasma volume. Let's move forward. 3 on 6, mid-systolic murmur at the upper right sternal border, wrong answer. This is aortic stenosis. So USMLE really wants you to be able to contrast this with aortic regurg. So aortic stenosis is going to be slow rising pulses, okay? Pulses parvis et tardis. Obviously, bicuspid aortic valve, such as in Turner syndrome, is a big risk factor. Can be just senile calcification, but slow rising pulses, pulses parvis et tardis. In contrast, aortic regurg, we said, was bounding pulses, brisk upstroke with precipitous downstroke, head bobbing, okay, wide pulse pressure. That's aortic regurg. But aortic stenosis, slow rising pulses, pulses parvis et tardis. Very, very important, that distinction right there. 2 on 6, holostolic murmur, best heard at the apex, wrong answer. This is mitral regurg. Most common cause of mitral regurg is just general atherosclerosis causing ischemia. But I would say on USMLE, to my observation, the most important cause is post-MI, papillary or papillary muscle ruptures. They say someone had an MI hours ago or days ago. I've seen both, the ranges. And they'll say new onset holosystolic murmur plus dyspnea. That's papillary muscle rupture. That's mitral regurg, okay? Let's just, and also acute rheumatic heart disease. So acutely with rheumatic fever, you're going to have mitral regurg, but later in life, 5 to 10 plus years later, that's when it becomes the mitral stenosis. Choice A, correct answer, decrescendo holodiastolic murmur along the right sternal border. This is our aortic regurg. Okay, so as I already talked about, this is classically aortic dissection that retrograde propagates the aortic root, causes dilatation, and connective tissue disorders such as Marfan or Ehlers-Danlos. Very high yield, you know these murmurs. Okay, this is fair game. You have to take your training wheels off. You have to know what your murmurs sound like if you're going to pass step one. And then for step two, if you have any desire for a decent score, know your fucking murmurs. You know the deal. I'm going to continue making more content. If you like my stuff, subscribe to my channel. And I appreciate your time. That's it.